testimony, and I'll begin the first round of questions, but I want to note for the record, we have senators that are in and out because Thursday is a pretty busy hearing morning, and so we'll have senators, some here, some will be here and then ask questions, and folks will be appearing intermittently throughout the hearing. But so far, I know that Senator Rick Scott was here and Senator Blumenthal was here, and we'll be awaiting others after my questions and those of the ranking member. But I wanted to start with you, Patty Vessenmeyer, about your own experience. And I want to start by saying how much I appreciate, and know the committee appreciates, your willingness to share a personal story. That happens in hearings like this on a pretty regular basis, where an individual comes forward and talks about their own experience or that of their family. And from a distance, it might seem easy, but I can't imagine how difficult it is to recount difficult, painful moments, and doing it in the interest, of course, of helping others. So we're grateful for your willingness to do that, and telling your story is a very important part of the work we're trying to do together. I know that your husband was in an assisted living facility, and you were, as you indicated, paying privately for those services to make sure that he would get the care that he needed for dementia. And I know I've heard from my own constituents back home similar stories. For example, Angela, who's a constituent of mine from Johnstown, Pennsylvania, Cambria County, out in the southwestern region of our state, she wrote to me and said that her father was in one facility that charged $7,200 a month. Now, I know that's not the average. It's very high. That works out to about $90,000 a year. And Angela shared, and I'm quoting her here, quote, "There was always a sense that no one cared for the residents beyond their monthly payments," unquote. That's one experience, and that's one person's personal experience. But Ms. Vessenmeyer, I wanted to ask, based upon your experience with your husband, did the facilities he lived in deliver on the care that they promised to provide?
Thank you, Senator. Thank you for appreciating me coming and doing this. And I think the good news is it's been 6 years and I'm able to do it without getting overly emotional. No, they did not deliver. They definitely overpromised, and understand that they were absolutely a memory care facility, specialized in it, and knew what they were doing. His basic needs were not often met. You could hear through some of the examples that I gave. And I observed other people the same way. They would actually recommend that you pay an additional private caregiver to come in to give them the care they really should have gotten, but their staff was there just wasn't enough staff for them to get it done. And do understand that their staff was friendly and caring, and they were wonderful people who weren't trained, and they were just overwhelmed. But they definitely did not deliver. And by the way, it did come out of my pocket because my husband had chosen not to do long care insurance. And that number that the woman gave you was low. That was my starting figure, was $7,900. It cost me closer to $13,000 a month.
Mm-hmm. We're grateful for you sharing your own story, your own experience. And I wanted to next turn to Richard Mollett. You mentioned a need for more substantive and meaningful ways for residents who might choose a particular facility or their families to know which services they receive, how much those services cost, the outcomes for residents living in a specific assisted living facility. For a family searching for care, and we hear about this all the time, I'm not sure doubt there's anyone in this room who doesn't know someone who's had the experience of having to search for care and to try to navigate it. It's obviously difficult to find the information that folks need about assisted living facilities. And sometimes they only have the word of an assisted living provider, or maybe someone else who's had their own experience they can rely upon. Can you elaborate more on the challenges that families have in finding both accurate information and unbiased information about services, about costs, about care outcomes for residents in assisted living facilities.
Thank you. So essentially, there's no independent validated information on assisted living for the consumers, for policymakers, or for the general public. So families, as you noted, have to rely on facilities, on facility marketing materials. They also quite often rely on companies like A Place for Mom and other so-called consumer resources, that are not independent of the industry. Companies like Caring.com and Place for Mom that actually get money from facilities to be listed. So that's not independent either. That's not something that people can rely on as being necessarily an accurate information of what has happened, what they're going to pay for, and what they're going to get. And the state websites really are the last resource, and they tend to be very flimsy. I haven't looked at every single one, but the ones
tend
that
to be, you
very
said
flimsy. I'm sorry.
flimsy, okay.
Yeah. Most often what we'll see is they just list the facility, they may list the facility's administrator, the phone number, and the address. Sometimes there's a little bit of information, but you cannot, in my experience, ever get into finding out really what the staffing is, what the costs are going to be, or what the quality has been on any issues.
And I know that going back to your testimony, you mentioned the three recommendations. The first one was establish and implement national standards to promote quality, safety, and integrity in assisted living. The second was establish a national assisted living database. Is that what you're referring to?
Yes. Yeah. Similar to Care Compare, if I may, or there's Nursing Home Care Compare, Home Health Care Compare, Hospital Care Compare. On the Medicare website, there should be an assisted living compare.
Well, I think it's pretty fundamental that people should have the opportunity to place reliance upon a source that is objective and to use your word, independent. I think that's true in any walk of life. Why would someone why should we settle for just relying upon assertions by those who are operating facilities? So I think that's pretty elementary, but we haven't reached that point yet in terms of a change in policy. I know I'm over time, but I'll turn to our ranking member Braun.
Thank you,